There are non-surgical options for patients with migraines. Starting at the most basic, there's medications. Prescription medications that are typical for chronic migraine sufferers are either preventive or abortive. So preventive medications are your medicines that are like your antidepressants, such as amitriptyline or venlafaxine or Effexor. Some anticonvulsants, the most common one you might hear of is Topamax. And then other medications such as Nurtec, those are all preventive. And then your abortive medications, the most common ones are your triptans. So your sumatriptan is probably the one that people hear about the most. And then the ergots, so ergotamine is a really common one as well. And the triptans will actually help constrict the blood vessels that help reduce inflammation, and the ergots will actually block some serotonin receptors. And those are all to stop a migraine. So that's what somebody would reach for if they feel a migraine coming on. I think the most common one I hear about is related to the triptan medications. So those can actually cause a chest tightness, as well as some fatigue, myalgias, and flushing are pretty common. Patients who have had a stroke or a prior heart attack aren't allowed to take your triptans. And then I think people are very aware of Botox and that's its role in treating migraines. So the FDA does have approval for Botox in the treatment of chronic migraines, and they have a pretty specific injection protocol. When you go and get Botox injected, according to kind of the FDA protocol, you have all of these muscles injected, whether or not your migraine is starting at all of those places. So in my patient that I'm working up for migraine surgery, I like to be a little bit more specific with my Botox injection and only inject where I think their trigger site is. So if their migraine is starting in the back of their skull or their neck, then I would focus on those muscles, like along the trapezius, and less on like the frontal muscles. For clarity of nerve involvement, I would be a little bit more specific with my injections. There are devices that some patients can wear that help with migraines. These are called remote electrical neuromodulation devices. They essentially stimulate certain nerves or use some sort of electrical stimulation to help treat migraines. I think that's probably more patient specific. I do think that in many patients, these non-surgical options can be very beneficial and help patients live almost a normal life, almost migraine free. So there are certain foods, when ingested, they can trigger migraines. So common ones are artificial sweeteners, nitrate-containing foods. Alcohol is one of the biggest triggers of migraines. On the flip side of that, some foods can help stop migraines. So caffeine, that can become then lead to a dependence, but caffeine can help with migraines. Electrolytes, some people have talked about turmeric and things of that nature can also help prevent migraines or treat them. Certain exercises can be a trigger for migraines in patients. I think the most common is patients whose trigger point is kind of occipital and their trapezius muscle can constrict it. So any sort of exercise that would contract that muscle. But I think a balance of sleep and a balance of exercise, like with anything, can help with migraines. Alcohol avoidance, I think, is always preached to migraine patients as well. And, there's other alternative therapies. And I think it's important to validate the patient experience. If they feel like these things help their headaches, then believe them. So like acupuncture, yoga, meditation, therapy, if they're particularly anxious or stressed, lifestyle modifications definitely can improve the frequency and intensity of migraines. So ice or heat can help migraines if they're triggered by, it's a certain vessel that is compressing the nerve. Putting ice to constrict that vessel can stop it from compressing that nerve. Kind of, you think about this artery up here, a lot of times will compress the nerve there and cause migraines. Ice might help with that. Heat, similar to the massage, can help maybe relax a muscle that's serving as a compression point of a peripheral nerve. Some of the most effective or most well-known medications for migraine relief are your Aleve, your Tylenol, and ibuprofen, or the Excedrin migraine cocktail. The secret ingredient in Excedrin migraine is the caffeine, and that can help be a powerful abortive medicine for migraines.
Basu Plastic Surgery is located in Northwest Houston in the Town Lake area of Cypress. To learn more about the practice or ask a question, go to basuplasticsurgery.com/podcast. On Instagram, follow Dr. Basu and the team at Basu Plastic Surgery. That's BASU Plastic Surgery. Behind the Double Doors is a production of The Axis, TheAxis.io.